we will jump right in. Good afternoon, everyone. Welcome to another CIRI Connect. My name is Ashley Gaudiano, and I'm the Director of External Affairs at the Connecticut Institute for Refugees and Immigrants. I'm really excited about today's conversation because it's a topic that is on everyone's mind, COVID-19 vaccines. So as we go through today's conversation, please feel free to leave your comments in the comment box on Facebook. I'll read through them to the best of my ability, and anything we don't answer, I will respond after the fact. So today I'm really excited to be joined by Dr. Frank Illuzzi of Hartford Healthcare Medical Group. Dr. Illuzzi, you have quite the spread of titles, so I'm actually going to turn it over to you for a quick introduction of yourself, if you don't mind.
Sure, Ashley, thank you for having me. No, I'm an emergency medicine physician first and foremost. My current title is I'm the medical director for specialty services in Fairfield County for Hartford Healthcare, and like you said, that's a mouthful. But personally, you know, one of my areas of interest is vaccine acceptance and vaccine confidence. Especially when it comes to pandemics like this. We had, you know, similar events back with H1N1 when we had the swine flu, and, you know, we had other things that we had to deal with, you know, in terms of Ebola and the Zika crises as well. So, you know, now that we have the current pandemic, I understand there's certain issues that we have to work through in terms of, you know, getting vaccines prepared and getting vaccines distributed. And one of the things is establishing confidence within the vaccine. So I really appreciate you bringing me on, and we can just have a conversation about things that are on your members' minds.
Perfect. And I love that term, vaccine confidence. I think that that's such a good way to frame this and look at this as we're talking to service providers in the community, as we're talking to community members who maybe are talking to their neighbors. You know, it's really about instilling confidence and educating individuals about the vaccine and then letting them make an informed decision. So, you know, I know we're getting ready to switch to the next eligibility group on April 1st, which means everyone in Connecticut is soon going to be able to get the vaccine. So perfect timing for today's conversation. You know, we're going to talk a little bit about education around the vaccines. We'll do a little bit of myth busting around the vaccine, which I know is a great topic for you. What can people do in the community to ensure that their, as I said, neighbors, their clients are as well informed as possible? And then, of course, we'll wrap up with the clinics that Hartford Healthcare is providing in the Bridgeport area and how people can actually access the vaccine. So with all of that in the 30 minutes we have, let's start with information about how the COVID-19 vaccines work, because I know this is really the first point of kind of fact versus fiction. So there's 3 vaccines available, correct?
Sure. Well, in the United States, there's 3
in the
vaccines
United States.
available. Yes,
Perfect.
there's a number of them out there, but you know, the vaccines that are available in the United States, you know, you have the product put out by Pfizer, you have one put out by Johnson & Johnson, and you have another one put out by Moderna. And I mean, basically the way they work, and before we get to how they work, we'll just take a step back in terms of, you know, what do we know about these vaccines? Because we're still learning. You know, COVID-19 is a disease. It's caused by the SARS-CoV-2 virus, which is a new coronavirus. It causes a range of illnesses. Some people don't have any symptoms. Some people have very minor symptoms. And there's a whole continuum up to really severely ill, hospitalized, intubated, and, you know, a lot of people die from this. And while we do know that, you know, there are some risk factors that can indicate that you may get sick, you know, if you're older in age, and that age has been going down. You know, it was 75 and up, and then it was 65 and up, and then it was 50 and up, and, you know, comorbidities like blood pressure and diabetes and obesity, they contribute. But the really confounding factor about this is we really don't know. There's another factor where there's a lot of young people in their 20s, 30s, and 40s who get really sick from this as well. We know that over 500,000 people have died in the US from this disease. And we know that certain communities are more vulnerable. And, you know, when you talk about the social determinants of health, when you talk about living conditions, when you talk about working conditions, when you talk about, you know, vertical households and, you know, cramped living quarters, and you talk about essential workers, and these are all communities that are adversely affected by this disease. So, this is a new disease. None of us have a natural immunity to it. And, we're going through the worst pandemic in 100 years. So the CDC has put out, information about how to protect yourself. Obviously, and I know everybody hates hearing this right now, but the simplest way is wearing a mask. So reduce the amount of germs that get transmitted, and it helps put a barrier so you're not breathing those germs in. You avoid close contact, especially indoors. You wash your hands or gel your hands frequently. Avoid touching your nose or your mouth. And the last line of defense is vaccines. And the way I consider the way vaccines work is it stimulates your immune response. So if all those other protective barriers like hand washing and masks fail, the vaccine is kind of like the goalkeeper preventing, the goal from scoring. And that's what the way the vaccines work. That's why they're so important. So to get back to your question, there are 3 vaccines that are approved in the United States. What they're designed to do is they take a protein from the vaccine coat. It's the spike protein that's used for the viruses to attach to the cell. We figured out what the code is in order to make that protein. And so what the vaccines are is we take this, basically this recipe to make the spike protein, and we inject it into you so your body can make spike proteins. Okay. And then your body can make an immune response against the spike protein. So then when the virus gets in your body recognizes it as foreign. It's like telling the police, this is the wanted poster, this is the bad guy, go get him. And your body is protected from the virus. So that's how vaccines essentially work.
Okay. So the COVID-19 virus isn't being injected.
Yeah, no, there is no virus in the vaccine. Right. What these are, and thank you for the question. There's 2 types, as you said. The Moderna and the Pfizer vaccines use an mRNA, which is a message. And it's basically the recipe for the spike protein that's encapsulated in a little lipid bubble, and it gets injected into you. Your body unpackages it, reads the message, and starts making these spike proteins and puts them on the cells so that this way your immune system knows what the virus looks like. So when you get infected with the virus, it can attack it. The Johnson & Johnson vaccine and the AstraZeneca vaccine, when that gets approved, so there'll be 4 once that gets approved, those 2 vaccines use a inactivated harmless cold virus. It's an adenovirus, and they put the message inside the virus and they let the virus, then get injected in, and it teaches the cell how to make these proteins. So this way the immune response occurs and it attacks anything with that viral protein. It's just a message that's getting injected in.
I love that analogy.
There's no way you can get COVID. You're not getting injected any COVID virus or anything in the vaccine. It's just a little recipe in order to make the spike proteins.
Yeah, I think that makes it super helpful because the science of it all can be a little over, my head and others' head. But when you hear that it's just a recipe and your body's just reading that and reacting to that, it makes it a little bit easier to both grasp and understand and want to get it. We're seeing, you mentioned all of these things we should be doing around washing our hands, wearing a mask. If you get the vaccine, do you stop doing those things?
No, you don't. You really, that's like playing, using the soccer game analogy, that's like playing a game of soccer with just the goalkeeper. And eventually the goalkeeper is going to miss a goal, no matter how good the goalkeeper is. You use vaccines to create an immune response. So this way your body knows what the virus looks like if you get infected with it, so it can go and fight it off. Nothing is 100%. And you want to, do all the things to reduce the amount of vaccine that actually gets into your body, hence the hand washing and the mask wearing and the avoiding crowded indoor facilities, because you want to decrease the amount of load of virus that you're actually exposed to.
Okay. We're seeing an uptick in cases here in Connecticut again. I know we talked about this briefly before we hopped on. Certainly scary given all the work we've put into this. Why is it important, given the uptick, why is it so important that people get the COVID vaccine?
So I think you're seeing it, and you alluded to it. We've had a number of, bumps or upticks in the amount of virus that you're seeing in the community. And every time we start succeeding and doing well, we kind of drop our guard and we see the numbers come up. And the reason for that is, although, we've had millions of people get infected, there's 330 million people in this country, and a lot of people haven't been exposed to this yet. And there's
Right.
not enough people that have any kind of immunity to this to prevent them from getting the virus. So every time we drop our defenses, like the mask wearing and not gathering in enclosed areas, you're going to see an uptick going up.
Okay.
What the vaccine does, however, is it's kind of, if you imagine a forest fire and you can hose down the forest ahead of time, as the
Yep.
virus approaches, if the population has been vaccinated, it's like the forest fire hitting the area that's been hosed down,
That
and it kind
wall.
of
Yeah.
snuffs out, the
Okay.
progression of the forest fire. If you don't hose it down, if you don't vaccinate, that fire is going to just rip right through the rest of the forest. So the reason why it's important to wear the masks is to prevent, or to delay the progression of that forest fire. And the reason why you vaccinate is so when the forest fire actually hits where you are, it extinguishes the oncoming fire, using that analogy. Does that make
Okay.
sense?
It does. It does. I think the message that it's not yet time to let down our guard is critical right now,
We are
right? We
so
really all
close.
need to be doing our job in this.
As an ER physician, I'm telling you, I am very fed up with this pandemic. I will be the first. Once we're able to get back to normal, I am going. It's going to be a joyous day.
Yeah,
But
it will.
I need everybody to just look. We're so close. I really think it's a matter of weeks, not months, at this point. Once
Okay.
we get the Johnson & Johnson vaccine out there, and we get millions and millions of more shots in arms, I think what you're going to see is you're going to see that forest fire hose down, and you're going to see it start to extinguish. And I'm really hoping that over the summertime, we can start to experience some form of normalcy. And I very much look forward to that. But I really think this is a matter of weeks. This is not a matter of months or years. And if everybody just holds their ground and does what they need to do, we're going to get through this in short
We'll
order.
be good. All right, that's good to hear. So let's turn to talking to community service providers a little bit.
Sure.
Many of the people listening to this now or who will listen to this after the fact are community service providers in the Bridgeport area, maybe throughout the state, but definitely the Bridgeport area, with really one goal, right? To reduce the spread of COVID-19, to ensure that they can continue providing services to their clients. What advice do you give those providers about instilling vaccine confidence in the clients or the people they serve?
Absolutely. No, this is a great question. And I've had this conversation with my staff. I've had this conversation with hospital staff. I've had this conversation with community leaders. It's really important to engender confidence, vaccine confidence in the public. Folks need to have trust, and they need to have trust in three things. They have to have trust in the vaccines that actually are being recommended. They have to trust the actual products. They have to trust in the providers who are administering those vaccines. Okay, and they have to have trust in the entire process along the way. How they were developed, how they were tested, how they got FDA approval, how they were distributed, if they were distributed in an equitable manner. All those things go into vaccine confidence. And so it's really important that as leaders, whether you're talking about medical leaders, or you're talking about community leaders or religious leaders, organizational leaders, those leaders have to understand those three concepts, and they have to be able to speak clearly and concisely, factually, in order to establish that trust. And we've had this conversation before. Your message needs to be clear and concise, and the messenger has to have already gained the trust of the population you're talking to.
Right.
So those are the essential components, and so it's really important that leaders of communities and leaders of organizations and leaders of religious leaders and medical leaders, it's very important that we use our positions to communicate factual information in a clear and concise manner to our constituents, just so they develop the confidence in the product and the process and the people involved in vaccination.
Yeah, that makes sense. And we talked a little bit about the trust in the vaccine product, right? And how those vaccines actually work. We'll talk a little bit about trust in the process when we do some myth busting. What about that middle piece, the trust in the providers who are administering the vaccine? Is there anything specific you want to say about that second component?
What we like to do is we like to partner with medical leaders in the communities that we're administering to. I think it's very important that if you see members of your own peers, members who are respected in your communities, I think it's very important that the family physician or the family healthcare provider has this conversation and has this conversation where they can give an enthusiastic endorsement that this is the reason why the vaccine is important for you, because that primary physician is going to know your medical history and it's going to have that relationship, will have earned that trust, getting you through other medical issues during your lifetime or your children's lifetime. And that's going to be your point person in order to get this information and distill it to where this suits what your needs and concerns are.
Absolutely. That's the beauty of, groups too, like Southwest Community Center in Bridgeport, where our clients go, or some of the local, we've got Dr. Malik right down the street from our Bridgeport office, right? People go there and trust them. So, I think that coupled with, again, service providers who have gained the trust of clients like CIRI, who works, day in and day out, also communicating the message and why this piece of the puzzle is so important.
Precisely. I mean, your organization has been walking the walk for 100 years, okay? And, generation after generation, immigrant coming in here have depended upon you, not just for medical, but for, social reasons and assimilation and legal support. And you've earned the trust of the populations you serve. I think it's very important that, members of your organization understand, basically what is needed in order to develop trust in vaccines and why it's particularly important for your communities you serve to become vaccinated, because they've been so hard hit by this terrible pandemic.
Yeah, and I know, having spoken with some members of the Hartford Healthcare team, that you all are more than willing to do presentations to community-based organizations. You did one for CIRI staff, doing that so that staff at organizations throughout the city, throughout the state, know and have the information they need to be able to speak with their clients. So that certainly is a resource that's available to providers who are listening.
It's all of our responsibility. Happy to do it.
Yeah. All right. Awesome. So let's turn to myth busting. This is my favorite part of our internal conversation, because there are just so many misconceptions around the COVID vaccine. I hear them within, my peer group. So I know that exists, and we need to do some work to educate around these. So I'm going to go one by one through some of the myths we've talked about, and then I'll let you chime in on, anything else that I didn't cover. So myth number one, will I get COVID from the vaccine? And then I'll turn it over to you and you can provide the myth bust on that.
Not a problem. This one's a softball. This is absolutely, there's no chance you can get COVID from the COVID vaccine. There is no COVID in it. Conversely, these vaccines are remarkably effective at preventing you from getting serious consequences of COVID or dying from COVID. The statistics are pretty impressive. This is a very effective vaccine against getting COVID, and there is zero chance of you getting COVID from any one of these vaccines.
All right, great. So no COVID from getting the vaccine. The other thing we hear is the approval process was so quick, or the vaccine development happened so fast, therefore it's not effective. What do you have to say to that one?
So, this is a great question. I get this all the time from my patients. First and foremost, I think people have to understand that this was our generation's moonshot. It really was amazing how quickly they found the gene that coded for the spike protein and were able to produce this. So I completely appreciate people being, in disbelief because
that science could do that,
because it happened so quickly. I'll walk you through, what this was. It'll just take a couple minutes just to debunk this myth. What happened was, one of the advantages we have now is we have the ability to sequence genomes very quickly. And so what happened was the genome for the protein for the entire virus actually was sequenced pretty quickly. Once we got a sample, we were able to sequence the genome, and we were able to find out which gene could create the spike protein. And so that was done pretty quickly. And once that was done, that was like the blueprint in order to make the recipe for the spike protein. And so what we were able to do is we were able to, with technology that already existed, create a number of potential vaccines. And there were probably 20 or 30 different vaccines that were, potential creation. Now,
Okay.
when you have 20 or 30 vaccines, typically what needs to happen is you have to go get funding, and then you have to take each one of these and develop this into a vaccine, and then take that and apply for a phase 1 trial and enroll 1,000 patients in each one of these phase 1 trials. And that all takes a lot of time. Usually it takes like 4 or 5 years in order to get the funding and get those trials
Okay.
put up. And the governments said that that's not going to work for us. We need to get this done immediately. And so what they did is they basically prepaid for all the funding for all that research. So all
Okay.
30
So
of those.
skip that phase.
Yeah, well, it's not skip those phase. All 30 of those, instead of going to individual investors and asking for
Right.
investments and stuff like
Right.
that, they basically said, "Look, we are blank check. We are going to fund for whatever research needs to be done, and we will start working on all 30 of these vaccines
Okay.
to see which ones look promising." So after the first round, it looked like there were about 10 or 12 that were rather promising after the phase 1 trials, which basically tests for safety, just to make sure everything is safe. And it looked, the phase 2 trials were to see if there's anything effective, and so they were able to run those 2 trials concurrently to see if there's anything that was
Okay.
safe and creating an immune response. And then they started doing the phase 3 trials in the again, and by the end of July, they were enrolling the first ones, I think, in Moderna and Pfizer. Now, the phase 3 trials are the ones you have to, get 30 to 40,000 people. And what they do is they follow them for 8 to 12 weeks. They have a control side and they have a test side. And they have a rigorous study where they basically, administer either a placebo or the test vaccine. And they follow these people over the 8 to 12 weeks. And you need to get about 30 to 40,000 people in these phase 3 trials in order to see if you have an effective response, if it's dose related,
Okay.
and you're decreasing the amount of disease in the test population. That phase 3 trial is the same phase 3 trial that we use for all vaccines that come out. And so they
Okay.
did that between July and late August and September. And Pfizer and Moderna were the first 2. They enrolled tens of thousands of patients in their study, and the results were remarkable. The reduction in mortality for the Pfizer and Moderna were both on the order of 95%. I'm sorry, it was 100%, and reducing the amount of virus that was present, or the amount of symptomatic disease, was reduced by 95%.
Wow. Okay.
And of the 40,000 patients, they had maybe a couple of allergic reactions in the Pfizer study, and they didn't even see any allergic reactions in the Moderna study. And so that's how they got emergency use authorization. The reason why I walk through all that is the process they used in order to approve those 2 to get emergency use authorization was identical to the process we've used to test
For
all of the
everything.
previous vaccines. And so
Okay.
we were pretty comfortable and we were pretty confident that these were safe and effective vaccines. Now, since they went live, 100 million people have received these vaccines.
Right.
And it's been, we're looking at the trajectory of, morbidity, mortality in the elderly population that we've administered to. And this is a particularly sick population. And the reduction in mortality for COVID in this population is absolutely dramatic. So we're now comfortable that 100 million doses given out. We're not seeing any significant safety concerns that aside from we're having allergic reactions in about 2 to 5 patients per million. They are very safe and they are very effective vaccines.
Okay. Great. I want to talk briefly about the variants and how that that came out. My understanding is that the variant came out after some of this testing was done, especially with the Moderna and Pfizer. Can you just talk briefly about that piece? I know we could go down a whole lengthy science rabbit hole, but when people are thinking, do I get Pfizer and Moderna? Do I not get Pfizer and Moderna because of the variants? How does that all work?
So the short answer to that is, whichever vaccine, whether it's Moderna, Pfizer, or Johnson & Johnson, becomes first available to you, take it. The equivalency, if it is, they are equivalently effective. That would be my recommendation for you. I know some of my patients have actually asked me about the Johnson & Johnson. The numbers were a little bit lower. It was only 75% effective as opposed to 95% effective. I tell people you're really comparing apples and oranges at this point, because the tests for Pfizer and Moderna were back in October before those resistant strains kind of hit. And now that there are more resistant strains and the virus has had a chance to mutate a little bit and adjust to it, you can't really compare the numbers for the two studies. I can say that the Johnson & Johnson numbers that came out were very impressive. 100% reduction in mortality and 85% reduction in hospitalizations. That's what we are making the vaccines for, is to protect you from, getting hospitalized or dying from this virus. And it is a tremendously effective vaccine. If this were available tomorrow to my wife and my kids, I would happily let them get the Johnson & Johnson vaccine.
Okay. So what I hear is get whatever you can get, take what you can get. And, if you're at a place where you're ready to get vaccinated, don't let those numbers deter you from getting one over the other.
I think this is a very dangerous virus. This is a very dangerous disease, and 500,000 people have already died from this. I'll take, the odds, 500,000 with a death rate of, somewhere between 0.5% and 1%. I don't want to get this virus. I don't want to get this disease.
Yeah, absolutely. All right, great. So a few more myths. Is it safe to get the vaccine if I have allergies? That's one thing we hear, right?
Sure.
I have an allergy to amoxicillin and penicillin. Should I worry about this?
This is a good one. And this is something that I would encourage people to talk to their doctor about, because allergies can be, a little confounding. This is not your average allergy. So if you have an egg allergy, or you have an allergy to strawberries, or you have an allergy to penicillin, you have an allergy to dairy, or that doesn't apply. The allergy that people are getting is to injectable medications. There are a couple components in injectable medications that can be allergenic, and they think that those are the reasons why people are having an allergic reaction. So if you've had an allergic reaction to a vaccine in the past, this is something I want you to talk to your doctor about, okay? If you've had an allergic reaction to some kind of an injectable medication, again, this is something I would talk to my doctor about. But if you haven't had an allergy to one of those, obviously, I would mention it to the nurse or the physician as you're getting the vaccine. But this is something that it should not cause any problems with. And again, the incidence of an anaphylactic reaction, the severe allergy to this vaccine, it's somewhere between 2 and 5 per 1 million people who get this vaccine.
Wow.
It is a very, very small number that are getting this. Every one of those is making the news. But again, if you have a severe allergy to an injectable disease, talk to your doctor.
Okay. And by no means do we give out medical advice on Zoom conversations. So, from both perspectives, talk to your doctor sounds like a great answer if you're concerned. We serve a lot of minority community members, and I know that many of the providers in Bridgeport do as well. One of the concerns we hear is, were minorities represented in clinical trials? What's the answer to that?
No, that is a great question. And, these vaccine trials were actually very impressive. We have in the field of medicine, we haven't always done such a great job in having representative samples in trials. These particular trials, the Moderna vaccine trial, I believe, had 35% minority. It was in 3 different countries. It was studied in the United States, and it was studied in South Africa, and it was studied. There was the Pfizer study, I believe, had 44,000 patients, and large representative minority populations. Asian, African American, Hispanic, a wide range of age groups. So these were very diversely well-structured studies that represented different populations, especially the populations that are most at risk, it now appears, to this virus.
Okay, great. Any other myths I've missed that you want to go through?
Well, there's a ton. What I would recommend, and I'll give you a couple, but what I would recommend is, if you have questions, there's a couple of very good places. I just want you to go to trusted sites. The CDC.gov site has great information on myths and myth busting. Hartford Healthcare Organization has a great site if you want to go for the public, or as providers, we can go on. It has up-to-date information and links anywhere. So it has a lot of curated, very good information about this. And I would recommend, if you have a question, seek your primary care provider, seek one of us here at Hartford Healthcare, or go to one of the websites. But I want you to get the information from trusted sites, because there are things out there that are just, they're not
Yeah.
accurate. And I want to be very, very careful about that. So I want you to get your information from a trusted site. A couple of the things that have come up, I've had my pregnant patients come up to me and say, hey, should I get this? And again, that is something that I will have the conversation with them as a patient in the emergency department, but I will usually redirect them to their OBGYN.
Okay.
I do direct them to the American College of Obstetrics and Gynecology, put out a position statement on this. It's on their website, and it was co-authored with the CDC. They recommended that this vaccine should not be withheld from pregnant patients or lactating patients.
Right.
And it should be made available to any pregnant patient who wants it and any lactating patient who wants it.
Right.
They feel the side effect profile, it should be very safe.
Okay.
But that is something that I would defer to, the OBGYN. But if you have a question about, go to the ACOG website. Likewise, I've had other patients come to me and ask me about, they wanted to know if this affected their reproductive cycle, or if this was going to affect their ability to have children or anything. That I can tell you equivocally, no, this will not affect, this has no effect on the reproductive system. This will not affect your ability to have children, either presently or in the future. It's just biologically, it doesn't affect anywhere in the reproductive system. So I've had a lot of concerns about reproduction and future reproduction. I can say equivocally, this will not affect it.
Okay, great. And I'll just add, you threw out both the CDC and the Hartford Healthcare website. When I put this recorded video up on the CIRI website, I will link to those resources. And I know from our perspective, many of them are bilingual, which has been incredibly helpful. So for people listening or watching who serve bilingual clients, these resources are available in a plethora of languages. And you all at Hartford Healthcare continue to hear what other resources or what other language may be necessary, and then create the content in the appropriate languages. So that's been really great on our end.
Well, it's really important to get out in the community and have the conversation. And it's a conversation. This isn't a one way, you have to talk to people and listen and listen and listen. So I think it's very important, the work that your organization is doing as well.
Well, thank you. So we're coming to the end. So I've got two more things. One, we hear about people getting sick after the vaccine, right? Achy, chills, fever, exhaustion. And I know that for many of our clients, taking another day off of work or taking a day off of work is a challenge. What do you say to people who may be concerned about getting sick after the vaccine and therefore may be hesitant to even get it because of that concern?
Sure. Well, I think part of the trust issue is you have to be accurate and you have to be upfront. These vaccines are reactogenic. They are designed to create an immune response. About 40% of the population, it seems, are having reactogenicity or an immune response. It's typically after the second dose. It happens about 12 hours afterwards. And people can have what feels like flu-like symptoms. It could be like fever, chills, shakes, myalgias. And I experienced this as well when I got my vaccine. It lasted for about 4 to 6 hours. Sometimes it lasts a little bit longer. And these.
Oops. Off those lights, right?
Oh yeah, those are the automatic lights. So.
The automatic ones.
But they're short-lived and they last, like I said, for about 6 to 8 to 12 hours, and then they go away. It's mitigated by Tylenol or Advil, plenty of fluids, and rest. One of the things, especially in the emergency department, we have shifts that we got to cover, 24/7, 365. We try and give the vaccine, on the last day of like a 3 or 4 day run when you have the next day off. So this way, the following day, if you're feeling under the weather, you have a chance to rest, and we try and time it in your work schedule to see. So, if you're working Monday through Friday, or if you're working, let's say the weekend, you do the Saturday and Sunday, you get the shot on the Sunday. And then, so Monday is your day of rest. This way you can recover and you have time to go back. So that's usually what we do, in trying to time when to get the vaccine, if it's possible.
Okay. So be prepared that you could have symptoms, flu-like symptoms, though you may not, and to the extent that you can schedule around your shifts, whatever that may be.
Absolutely.
Seems like a good idea. Wonderful. So let's round up the conversation with what may be some of the most important information for this moment, which is where can I get my vaccine?
Absolutely.
You know, I know, and correct me if I'm wrong, I know that Hartford Healthcare is running a handful of clinics in and around Bridgeport. You've got the mass vaccination clinic at Central High School, I believe,
That's correct.
and Sacred Heart in Fairfield, which I know isn't the most convenient for some of our clients, but Central certainly is.
Sure. And we're also very happy to, if you go on the website, we actually have our FEMA mobile van in order to bring the vaccine out to the community. Monday and Tuesday, actually, so the March 29th and 30th, we were at the Beardsley Zoo. On the 31st and 1st, we're going to be at the Department of Public Health on East Main Street. On April 2nd and 3rd, we're going to be at the Park City Magnet School on Chopsy Hill Road. The 4th and the 5th, and yes, we are doing it on Easter Sunday as well. We're going to be at the Bird Street and Park at the PT Barnum Apartments. And April 6th and 7th, we're going to be at Webster Bank Arena parking lot. So we have the FEMA truck going out into the community to make it convenient for people. If you want to call and make an appointment, the number which is dedicated for Bridgeport residents is 860-827-7400. That's 860-827-7400. And after we're done, I can get you this information. Or you could just go online to hartfordhealthcare.org/vaccine.
Okay, perfect. And my understanding is the FEMA trailer appointments are recommended, but not required. People can just walk up to that trailer at its location over the next 8 or 9 days. Is that accurate?
It is accurate. I would recommend just getting the appointment. This is right. It's like going to the really new popular restaurant and everybody wants to go, and then you get upset when you have to wait an hour to get in because everybody the wait. I would call and get the appointment ahead of time. This way, when you're going, you have the shot. It's all. I personally, I would either call or go online and schedule the vaccine. But yes, the FEMA truck is walk-in. The Central High School site and the Sacred Heart sites are by appointment only. Okay,
perfect. And the FEMA trailer is Bridgeport residents only. Is that's correct as well? That's okay. Correct. So us folks over in Trumbull can't hop down to Bridgeport. We need to make sure that FEMA trailer is for Bridgeport residents. But Hartford
Sacred Heart is pretty convenient to you guys, though. You just have to shoot down the road. You're right there.
It is. It is. All right. So is there anything else before we wrap up? Anything else that we've missed that we didn't talk about that you wanted to mention?
No, I think you touched on most of the points. I mean, the point is we're just so close to the end. I mean, I really see the finish line here. And I think if we all do what we know is the right thing to do and just, get this there, I think things are going to start opening up. We're going to start being able to enjoy, what we normally enjoy in regular life, get together again. There's a lot of, grandparents that haven't been able to see their children, their grandchildren. There's a lot of events that have been postponed because of this pandemic. And this is the last final push. If we can get, people vaccinated and protected, one, it's going to save a lot of lives, and two, we're going to get back to normal quicker. So I would just encourage to start the dialogue with your healthcare providers, your religious leaders, your community leaders. Get the information that you need in order to be comfortable with this. And you have questions, ask them. There is no silly question. We want to provide the information. Absolutely. We want people to be comfortable with this, and we want people to have confidence in the vaccines and the people who are giving them.
Wonderful. Well, thank you again for your time today. I know that you are busy, but we're incredibly grateful to you and all of the staff at Hartford Healthcare for everything that you all are doing to make sure that people are educated and able to access the vaccine. So thank you again for your time today.
Ashley, right back at you. Thank you very much for all you guys do too. All right. Have a
great day.
Wonderful.
All right. Have a good one. Bye.
Bye-bye.